We are getting new information every day about the coronavirus pandemic, and we're also hearing some things that are not true. So we're sorting out what's fact and what's fiction with our friend, Dr. Lisa Larkin, founder and CEO of Ms. Medicine. Good to see you, Lisa. How are you getting along?
Good, thank you. So nice to be here. The world has changed, but
gosh, it sure has. And you know, one thing we heard recently was from the president about 2 drugs that look like they could be a treatment for COVID-19. Can you elaborate on that?
So I sure can. So first, let me tell you that as physicians, we are all, very concerned about this crisis, and everyone is looking at appropriate, effective treatment for patients. And so we all want to have options. And I think one of the things that I heard from a patient about President Trump's briefing was that part of the discussion about the availability of these drugs for treatment was to give the world hope. And so I think, hope is really important. But what I want to just say is, these drugs are available, but there really is such limited data about effectiveness for COVID-19 that, again, widespread mass utilization at this point is really not supported by any guidelines. In fact, the CDC has come out and said, at this point in time, there are no confirmed effective treatments. Now, let me talk to you about the difference between an asymptomatic healthy person who is worried about COVID and a patient who's sick in the intensive care unit with advanced lung disease that potentially is battling for their life. I think the use of drugs that have not been well studied that are available for treatment of someone who's facing a life-threatening infection is very different than prescribing it to patients who are well, but worried.
So how come doctors are prescribing it then? There's an article in the Columbus Dispatch this week about doctors prescribing this for their patients, and some doctors in other states even prescribing it for their own families.
Right. So I have great concerns about this. So first of all, it's not illegal for a physician to prescribe a medication. We call it off-label. So even though chloroquine or hydroxychloroquine is not FDA approved of COVID-19, it is not illegal for a physician to prescribe chloroquine or hydroxychloroquine for treatment of COVID-19. The problem, however, though, is that as physicians, of course, we have a responsibility to our own patients. But in this setting of a national public health crisis, we as physicians, I believe, have a responsibility to the larger United States. And what you have to think about, and I've seen this in my practice, I will tell you, that from the president's news briefing, within 60 minutes, I got 4 phone calls from patients asking me to prescribe chloroquine to them based on the president's comments. And the problem is, can you imagine, we are not equipped nationally to have that stockpile of those medications, and prescribing medications to patients who are healthy, who want to stockpile the medication, is depleting it from the availability for patients who are on it for other conditions where it is FDA approved, and for patients who are in New York on ventilators who are potentially dying, where really at that point we would prescribe medications and throw the kitchen sink at them. I think as a physician, we really have an ethical and moral obligation at this point to think of the greater good. And prescribing it to family members or to patients where the CDC does not recommend it now, I think is really a disservice to our national epidemic, where we really all have to be involved and fighting this battle nationally, not just on a one-off basis.
Right. I just want to ask you one last question, Dr. Larkin, before we have to part for today. I know that you're doing Facebook Lives with your husband, who's also a physician, every afternoon at 3 o'clock, and people can look on your Instagram to find out when those are. But one of the concerns that came up in one of your Facebook Lives was concerning ibuprofen and COVID-19 virus. Should we have concerns about taking ibuprofen?
Right. So this is another situation where there's not a lot of data, but where I think it's different than kind of the random prescribing of chloroquine or hydroxychloroquine and azithromycin for COVID is that in this setting, although there's limited data, I think because we have another medication such as Tylenol that you can substitute for ibuprofen to manage symptoms, that in this setting where we're just not sure, it probably is reasonable to avoid ibuprofen for treatment of symptoms at this point. Again, the World Health Organization has come out with a statement that Tylenol is preferred over anti-inflammatory, so I think that that's the correct approach. Again, but based on very, very limited data, So, not 100% certain.
No, it's good to have a little bit of that information, though. And Dr. Larkin, hopefully we can catch up with you soon, maybe next week. You let us know your schedule, okay?
Great. Thank you so much for having me.
Thank you.
Have a
All
great
right.
day.
You
Take
too.
care.
Bye-bye.
Bye.